So here we're treating glutes in one of the possible positions. This is through the towel in prone. So you can also treat glutes in side lie with them far more exposed than this. So this is probably how I would do it if I was connecting in the back. But if I really specifically needed to treat them, then I would probably put them in side lie or actually bring the towel right down and treat skin on skin.
So various ways to do it. If you're doing that and exposing much more of the glutes, you need to get your client involved. What you don't want to be doing is exposing lots of skin and their bum and they're not really involved in the treatment and they don't understand what you're doing and why. So a lot of people, I find, prefer to have the treatment through a towel. Not quite as easy for you, but as you see here, it's a sort of quite an appropriate contact. Again, very limited what you can do, because what you don't want to be doing is effectively rubbing someone's bum. But with sort of a key pressure here, you can see a little bit of movement. So we're almost sort of rocking the hips a little bit, but also that will increase the blood flow effectively through vibration into that glute area. So you can do that quickly or slowly with a limited amount of pressure. As you can see there, I'm almost supporting my own body to hold the pressure off that glute. I'm not leaning my entire body weight onto someone's glute.
No, glutes can actually be really sensitive for the size of the muscle that you've got there and sort of the depth you're getting through. It is actually quite sensitive, and when you stick your elbow into somebody's glute, what you will feel it do is contract quickly. So you need to kind of go in slowly and sort of work your way through the layers really. But here Charlotte has just changed position to do a little bit more work with the elbow. It's probably one of the easiest ways to treat the glute when you're working through a towel.
It'll also be really useful. You can utilise this sort of positioning to work on sort of the piriformis, the deep hip rotators as well. Obviously, most of them you're not going to be working directly. It'll be an indirect treatment through the glute muscles which are overlapping, but you will get some treatment and some benefit from that. Important again, especially with a muscle this large, watching your posture. You can see here I'm really lunged into this, really supporting myself, and very, very neutral spine, which is really key to this treatment really.
What you can also introduce into this is actually running along the top of the glute line there that's exposed with the reverse cam and spindle, because remember the glutes come up onto the top of that iliac crest, so you can actually get to the attachments there.
So as Tamsin said earlier, you'll see quite a lot of that into the back. So this is a really nice way of integrating the glutes in. So some of the techniques that we've talked about will overlap quite a lot in this area.